So we're going to go over how to identify the equipment for Tel Aviv University Dental extractions. Each equipment is for a specific step in the extraction procedure. Step one is we're going to go for separation of the PDL. We need a mirror and a curette. So we're going to hold the mirror in the left hand, and you're going to use that for retraction of the lips and of the cheek, and you're going to use the curette, which is called a Lukas in Hebrew. We're going to put it in and do a knife-like motion, a sweeping motion around the gingiva with this instrument, the curette. It's great for getting onto the buccal and onto the lingual surfaces of the tooth. There's one little exception you should note, that on tooth number 41, on the lower anteriors, you do not use this on the buccal. You only use it on the mesial distal and also on the palatal. You can use it on the mesial buccal and on the distal buccal area, but do not use it on the direct buccal, because number 41 and number 31 have a very thin buccal plate. So step one, we did separation of the PDL using the mirror and the curette. Step two, we're going to use a lever action, the manof. Our goal is to luxate the tooth using a straight elevator. The straight elevator comes in at a 45-degree angle, where you're coming down towards a 45-degree angle towards the apex of the tooth. Your goal is to get it as apical as you can towards the between the tooth and the bone. This is the bone area. You're going to rotate it. If we're trying to extract this tooth, we're going to rotate it such that the side with the capite, right over here, it's hard to see. Excellent. So this shinier side, this smoother side, is going to go on the tooth that you are not luxating, the tooth that you're not extracting, and this curved side is going to go on the tooth that you are trying to extract. You're going to come in at a 45-degree angle like this. This is bad, this is good. You come in and you rotate it, and you should start to feel some motion of the tooth. So that is the straight elevator. What else do I want to say about it? That's it. So that was the straight elevator, and we rotate it. In the literature, it will say that you can use this for step one for separation, but here at university, we do not do that. Also, the proper grip, you hold it like this, with your finger very close to the end, I'd say about a centimeter and a half. The reason why we do that is because if you slip, because this can be a dangerous instrument, you won't slip and damage the patient so much. You'll basically stop at your finger. And by this time, you should be having your left hand in the proper position for the extraction. And we can go over that in another video.
And this part should be...
This part, you just hold, the fatter part of the handle, you just hold right...
Like this. He said.
Oh, like this?
Yes.
Okay, so I guess you put the end of the straight elevator into kind of like the palm of your hand, but it's very important. He put a great emphasis on making sure that your second finger is very close to the end. Now I want to talk about step three, which is the actual extraction. I have the maxillary teeth up here, the maxillary equipment over here, and the mandible over here. So first thing I want to do is I want to talk about the maxillary anteriors. Maxillary anterior. As you can see, this is a straight elevator, and you'll see that we have some grooves on the inside, and I want to show this to you. Excellent. And you'll see that it's straight and that we're good with the maxillary. Now we're going to do the 150 universal upper. This is good for premolars. Here's the universal 50 upper. I'm going to give you a nice, awesome hint. When you're looking for this, it also has some grooves too. It actually says the word 150 on it. And just not to jump too far ahead, I just want, we keep hearing the word 150 a lot, 150 universal. This is the 150 universal upper, and this is the 150 universal lower. You'll see that this has a stronger right angle at this point. Okay. You're going to use that for premolars. Now we're going to on to the maxillary molars. There's a right and left. I'm picking up the upper, this is for the right. You'll see the obvious giveaway is this little spitz, this little point over here. It goes into the buccal surface of the maxillary molar M1 and M2. Here's the angle. I'm going to show you. You can see the difference. This one's going to be for the patient's upper left, and this is going to be for the patient's upper right. And here's a side shot of them. Okay, that takes care of the maxillary molars. The Bionate is used for maxillary root tips. It's not for the maxillary third molar. You see that the beak area is very tiny, especially when you compare it to the maxillary molar forceps that we were dealing with before. Okay, and you can see the angle. Now we're on to the mandibulars. I want to show you the mandibulars. This is for the anteriors. You can see the very small beak, and these are the grooves inside. Okay, now we're on to the 150 universal lower. We saw this before, and you see that the size of these are perfect for premolars. I don't want you to get confused between the upper and the lower universal, and we'll just review that quickly again. You'll see that this has a sharper angle, and as a side note, I should have said this from the beginning, I apologize. You'll see that all the mandibulars have a much sharper right angle with the pliers, with the pliers, whereas on the maxillary, it's a lot more straight, as you can see, and especially obviously on the straight for the maxillary anteriors. Okay, should have said that from the beginning. Now we're going on to the mandibular molars, M1 and M2. You'll see that you have two little spitzim, little points on both ends. And again, it's a very strong right angle. Now we're on to the final instrument, which is the mandibular third molar. And again, very similar to the one before, but it's a lot shorter beak, and it has a much sharper, it also has a strong right angle. It's a little different, but the beaks are very similar. Okay, and that's the end of our tape. Thank you.